Surrey County. The good news is that although we've seen a spike in the last week or two, our numbers are about 50 positive cases. We've had very few inpatient admissions. We've actually had 2. And I think that's the same with Hugh Chatham Hospital as well. So we're seeing very few hospitalizations, only 1 ICU patient out of the 50 or so positive cases. Not all coming to Northern, but many have. So we unfolded that plan. I also want to say kudos to a lady named Kitty Horton. Some of you even know Kitty, some of you don't. She's our IP, Infection Prevention Manager. She's led our efforts to protect our people here and to protect our patients, along with Dr. Etzel, who's our Chief Medical Officer. They really have done a fantastic job with our medical staff and leadership team. Beginning about 6 weeks ago, every Monday, Wednesday, and Friday at 8:30 a.m., Randy, we have a half-hour huddle where we update our team across, and everyone can call into this huddle, and then we record it and allow all 1,000 of our employees to hear the updates on what's going on with COVID locally, regionally, nationally, and even internationally, and any policies and procedures and protocols that we are changing, since this is dynamic, on really a day-to-day basis. So we've done that as well, and we try to communicate the good and bad of what's happening with COVID as in healthcare as well as outside healthcare. We've also been fortunate to receive some CARES Act funding money, which is really going to kind of get us through the rainy day. Our financials are pretty strong. Our balance sheet is relatively strong for a community hospital. But the impact operationally to Northern Regional Hospital is about $1 million a month on operating loss. So that's very substantial. And now we don't anticipate that will continue, but it has hit us hard, and that's due to 40% of our business, if you will, of our patients not receiving care, whether it be through self triaging or through curtailment of services that we have done. So CARES Act has helped us. It looks like we're going to receive about $9 million in grant money, and then there's some loan money that's available to us as well. Our greater concern, folks, is not necessarily what's happened in March through July, if you will. Our concern, and it may be the concern that you have as well with your own businesses, is what's going to happen to us and healthcare in general over the next year or 2 years. Our emergency department, for example, sees approximately, on average, 100 patients per day. We are now seeing 60 to 70 patients per day. We have patients in this community and region that are not receiving care. They're postponing care because of their fear of getting COVID by coming to the hospital. And that is a story and a message we're attempting to send. We are a very, very safe place to be, perhaps one of the safest places in Surrey County with all the measures that we've put in place. But we do have a lot of patients that are not receiving needed health care for fear of getting COVID if they were to go to the doctor's office or to the hospital for care. And that's a real concern to us as we see patients now coming to the ED with strokes and heart attacks and other types of major illnesses that should have been treated sooner but have been delayed because of the fear of COVID. Now, that's kind of the bad news. The good news is that we have instituted, and I'll kind of reference this right now, a resumption of services plan about 2 weeks ago that began on May 1st. This is a multi-phase, 16-step resumption of services plan, beginning with redoing or doing elective surgical services on May 1. So we are starting to see some patients return to the hospital for elective surgery. And then a number of other measures that we're putting in place. We're going we're going to continue to screen ourselves and screen visitors as they come to the hospital. We're going to continue to restrict visitation, but not so much as we had in the past. We are going to continue to require masking with hospital-approved masks when patients or staff come to the hospital until at least June 1st. Unfortunately, there are restrictions that have been placed on us through the governor's order regarding our skilled care services, where visitation is very, very restricted and will likely continue that way for some number of weeks, if not months. So we are beginning the process of phasing back to, I'd say, normal services, but normal may not ever be normal for us here at Northern Regional Hospital. So just two kind of closing remarks. One, it'll be interesting to see how Northern Regional Hospital is affected or impacted long-term from COVID-19. I'm talking about into 2021. Secondly, that we want to make sure we send a message that coming to this hospital, and it's probably the case for most hospitals, it's a safe place, and that we are prepared to take care of patients, whether it be COVID patients or non-COVID patients, which largely we're seeing at this point in time. And maybe the last note, I went on record with my team here. In my 35 years, I've never had a RIF. I've never had a furlough. I understand why they're necessary in some cases, but when you're preparing for a crisis or a surge of patients, it's really important to send a message to the staff here, that they're all essential, they're all needed, and we need them here to take care of our patients. So we've instituted some cost reduction measures. Our employees, I think, appreciate the perspective that we have maintained to protect jobs as long as we possibly can, and to make sure they feel safe and comfortable and secure that they have a job here at Northern Regional Hospital. A year from now, if things don't change, we may have to address our action plan, but right now we want our employees to feel good and safe and secure about their job, and that they're prepared to take care of patients as they come to Northern Regional Hospital. So Randy, that's just a quick overview of what's going on with Northern. I'll be glad to address any questions that the group has of me.
Joe asked a question: does Northern Regional Hospital employ hospitalists to cover the facility?
That's a really good question. The answer is yes. In fact, I was very fortunate at Halifax Regional, where I was CEO for 30 years, to have a really, really good hospitalist program. And this hospitalist program is as good, if not better, than Halifax. We have a great team of physicians and what we call APCs, advanced practice clinicians, nurse practitioners, PAs, that are in the hospital 24/7 to take care of inpatients and critical care patients as well. Well, Randy, that's a question, as I mentioned, that is asked of me almost every speaking engagement. Are we going to do urgent care? And the answer is yes.
Awesome.
That does not compete with our emergency department. These patients typically want to be seen very quickly. They're non-chronic type illnesses, in and out very quickly. Typically, it's a half-hour visit.
Right.
It's high volume, and it's a very cost-effective way for patients to receive minor type of care.
One of the attendees asks, are you doing anything with the video care, the I call them robot docs, but that seems to be a growing area where you may speak with a doctor over a Zoom call. What's your thoughts on that?
It's really called telemedicine.
Telemedicine.
Yes. We've been doing telemedicine here for years, for neurology, psychiatry as well. Since we don't have a psychiatrist, we don't have a neurologist, so we are partnering with a couple of the institutions in Winston-Salem. So if a patient comes into the ED and has a neuro problem, we can consult with a neurologist via telemedicine. What we're seeing now is that we're using it in the primary care practices as well, where a primary care physician or APC can see a patient virtually, just like we're doing today, and often can diagnose and prescribe based on their interview with the patient via telemedicine.
Can you share any data from the opening of the joint testing that you did through Hugh Chatham and your hospital that was recently done?
Yeah, Randy, I'm sorry I missed that. We actually, in concert with the public health department and the state, with Hugh Chatham, had a mass testing exercise or program, I should say, on Monday. We had mass testing here on campus in Dobson, as well as in Elkin with Hugh Chatham. I think the numbers were just shy of 600 people that were tested. We're just now getting the results, and I didn't see the numbers this morning, but as that last evening, we tested here at Northern 278 people. They drove through, paperwork was done, they were swabbed, and results, or the test was sent to the state. 2 days later, we got the results back. So of 175, approximately 175 that tests that we have received back from the 278 on Monday, 2 were positive and the rest were negative. Now, I don't know about the other 100 or so that I don't have the results on. Now, I don't know also the results of the Dobson or Hugh Chatham, but I would guess by today or tomorrow, those results will be out and likely publicized as well. Right. So the good news is that very few positive tests. And by the way, we have it again, Randy, this coming Monday from 1 to 6. We are also doing the mass testing again here, right, Dobson and at Hugh Chatham.